When it comes to choosing AML therapy, it's important to work with your healthcare team to identify what will be best for you. Would you walk us through the factors that are considered when choosing therapy for AML?
Sure. Yeah. So, we now have options with in treatments for the with treatments for this disease, and for decades that wasn't the case. This was a one size fits all type of a disease, and in the last 8 years, that has completely changed. So there are approaches at diagnosis that vary between very intensive chemotherapy and less intensive treatments. What we call targeted therapies in some cases can be considered or be appropriate. And so, having a sense after learning a little bit about this of how how much would you be willing to tolerate an intensive chemotherapy regimen and all the risks inherent in that, if that's even being presented as an option? And if so, what does that look like? And if not, hey, what are the other options? If that sort of doesn't sound like something that you would be willing to accept. I think those kind of probing questions, first asking yourself and then sort of translating that into your treatment team into, hey, this is sort of how I define quality of life, and these are some red lines that I wouldn't cross. That can really help the healthcare team, because again, this is not one size fits all anymore. We do have several options to consider at the time of diagnosis.
hmm Well, what other factors would you take into consideration? Do you look at age and overall health and fitness, test results?
Absolutely. So the relevant factors at the time of diagnosis would be, as you described, age to some extent. And there's no magic cutoff. When a person is a certain age, this is no longer a treatment option, but gives us guidelines. Other comorbidities, other, diseases that you may be dealing with, things in your past, organ dysfunction, all of those things are really highly considered. And also sort of your own attitude toward, hey, how would I be okay with a month-long stay in the hospital? Or is that something that, there's no sort of outcome that would be okay for me to withstand. But then the other huge part of this are things that are sort of at diagnosis unknown to you and unknown to your doctor for a little bit. And those are disease factors. So what are the mutations that make up your disease? What's making your disease tick? And now, just with normal clinical care, we have unbelievable access to this information. I mean, we can essentially learn within a week or two, every relevant mutation that's contributing to your disease. And that helps us tremendously with respect to prognostication, sure, but also treatment selection, because there are some treatments that, will work, we think, better with certain disease biology, and other treatments that will work less well. And we even have targeted therapies. So based on particular mutations or other abnormalities, sort of a rationally designed therapy for exactly that disease biology. So that is also, a huge part of treatment selection, and we call those disease factors.
Mhm. Why is molecular testing important following an AML diagnosis?
Right. So this is basically gets into what we were just discussing. So that molecular testing is the testing that will tell us all the mutations that make up your disease biology. And so, that is crucial for prognostication, but also treatment selection. So molecular testing is really, and frankly, also, when thinking about how to potentially cure your disease, those will be factors taken into account to make decisions that are pretty significant, such as, should you receive a bone marrow transplant at some point in the future or not? And the reason it's so crucial to get this done at diagnosis is, after diagnosis, we start a treatment, and hopefully we put your disease into a remission. And at that point, we no longer have access to your disease cells. They're gone, or they're too low to even measure. And so we need to get this information at diagnosis so that we can have it later on, so that we can really understand your disease and make the best treatment plan for you.